Hello and welcome to today's virtual roundtable. I'm Russ Holmes. I'm going to be your host for this session. Today's topic is COVID-19 screening. What is the right mix of solutions for you? Obviously, we've heard lots about COVID screening, COVID testing, and it really is a mix of solutions. And so we look forward to sharing with you today some of the various different solutions that are being used throughout the entire maritime industry. Before I get started, I did want to let you know and remind you that your camera is turned off and your microphones are off. However, we do want this to be an interactive session. In the control panel that you'll see on your screen, there is a chat function within there. Please feel free to submit any questions in the chat function that you may have for myself or my colleagues as we go through the webinar, and hopefully towards the end of our session, we'll have some time to be able to get to some of those. If we don't have time to get to all of them, we will commit to following up with you and making sure you do get your questions answered. Also, feel free to use the chat function as well. We've got people logging in from all over the world for this particular session, both on land and at sea. And so if you are on land or at sea, let us know where you're logging in from. We'd love to hear from you. If we'll move on to the next slide, you may have been not familiar with VIKAND. VIKAND is Swedish for we can. We are the leading medical and public health solutions provider to the global maritime industry. So that's not only cruise, commercial shipping, ferry industry, oil and gas sector, private yachts, private islands, as well as the fisheries sector as well. VIKAND provides solutions to the entire maritime industry, from 24/7 medical management, public health solutions, COVID-19 solutions and communicable diseases, biomedical equipment maintenance, as well as products, as well as air and surface decontamination. VIKAND provides support to over 32 companies, representing well over 200 ships at the moment and growing rapidly. Now I want to introduce some of my colleagues to you. First of all, I'd like to introduce to you Holly Love. She is our VP of Medical Operations. Holly, if you don't mind turning your camera on and saying a quick hello.
Good day. Good day, everyone.
All right. Good. Thank you, Holly, for joining us. I know it's early in the morning in your part of the world, but appreciate you taking the time to join us today. And then also, I'd like to introduce to you Tim Krulatz. Tim is our Director of Supply Chain Operations and supports many of our clients with biomedical equipment needs, COVID testing solutions. Good day to you, Tim. Thanks for joining us. I want to dive straight into some of the questions that we've got. We've had some great responses so far, and I want to turn my attention to you, Holly, if that's all right first. So tell us a bit about your role here at VIKAND and how our medical operations teams are currently supporting many of our clients.
Sure. My background is I'm a nurse, and my title today is VP of Medical Operations for VIKAND, and I oversee the medical services that our team delivers to our clients, and which is a broad range of services from supporting the medical teams on board, their formulary support, their equipment support, their protocols, procedures, medical emergencies, to everything that would involve supporting a medical center on board, including some public health components, which of course is our focus today, is COVID.
That's a great overview, and obviously under yourself, there's lots of different medical managers working directly one-on-one with each of our clients. And so as we turn to the COVID screening solutions, with regards to them, can you please share the differences at a high level? We've heard the two terms a lot, PCR and antigen testing. So if you could share with our audience today some of the differences between those two different types of testing, first of all.
Sure. Both testing, PCR and antigen, are considered diagnostic tools to diagnose a COVID case. The difference is that PCR is it's a test looking for the genetic material of the virus. It's a little bit more specific and can get, it's considered the gold standard in terms of diagnosing COVID. There are PCR tests that are considered point of care tests that many of our clients are using, and more elaborate PCR tests in the labs. Then we have antigen, which is also a diagnostic test, which tests the spike proteins that you see on the molecule, the virus, and that also, so it's looking for the protein spikes on the virus, which generally you can test for that after someone's been exposed to the virus for several days. A little bit later into the development of the illness, will an antigen test diagnose COVID.
Okay, well, no, it's a great overview and to really kind of understand, because obviously we've all become very familiar with those terms, unfortunately, over the last 15 months. And it is, you know, it is good to get a grasp of the differences between the two. And so, you know, I've been for COVID screening, and I'm sure many others have as well. And some of those can be administered by yourself, and some of them, you know, by a medical practitioner. So which screening solutions would need a medical practitioner to implement, and then which ones don't?
So what's called point of care tests, which are CLIA waived, clinical laboratory, I forget all the letters stand for, but if it's a CLIA waived test, meaning it doesn't take an advanced person or lab to use the test. And so then it's CLIA waived and it's a point of care test, which many of you have probably seen or heard of. They're smaller cartridges, you can buy them in bulk, they're done in clinics, many of the cruise ships are using them now. And the benefit of that is that you can test, anyone can run this test. There's even home kits that people can do on themselves. Tim will go into more detail on the different types of kits, but there are some that are actually with machines, and then there's some that are just more like a simple cartridge with no machine involved with doing the diagnostic test. Generally speaking, a medical person is trained to do these. They know how to do the quality assurance and the checks to be sure it's done correctly. It's really important to get the right amount of sample to run an accurate test, but non-clinicians can also be trained to use these kits. It's just making sure they're trained appropriately and have understand how to do it correctly to be assured you're getting an accurate result.
Okay, and so based on your team's feedback from our clients, you know, which methods are preferred at the moment? Obviously, the testing solutions keep changing and improving, but you know, is there any feedback that you can share with our audience today?
Sure.
Which ones are preferred?
So we've got different maritime markets, but generally in the cruise ship market, we're recommending a little bit of both. It's evolving and changing almost daily on testing and what's required. Is testing here to stay? Yes, most definitely. There's also the variables of where the ships are sailing to and the requirements of those local health authorities. Some places will only accept a PCR test and not an antigen test. There are differences, however, in these two tests. So back to your question, the recommendation more often is to a combination of the two. The challenge with the PCR point of care tests is they're great for diagnosing. So if someone has symptoms or you have a questionable antigen result and you want to confirm it with a PCR, that's how that's being used. The PCR is not great, the point of care test for PCR, for massive screening, because they take longer for results and you cannot run a ton of people at once on these point of care machines. That technology has not evolved yet. The antigen tests are less expensive generally. You can run more of them more quickly and are generally being used as a first line of screening a larger population in one time. The downside to antigen, as I've mentioned earlier, is that they don't They generally will not produce a positive. You could still have the virus, but have a very low level of virus in your system, and the antigen may not pick it up until that person's symptomatic. So antigen tests may not test out or demonstrate a true positive until they're several days into a viral load that's increasing. Unlike a PCR test that's screening for the genetic material, is going to more often, if someone's got a lower viral load, can pick up that virus and have a positive test result. So the combination of the two are being used in the industry today.
Okay, so yeah, like we said, the topic of today's virtual roundtable is what is the right mix, because it really is a blend to be able to support the different operations and the different verticals within the maritime industry. Now, there's two words that we hear quite often when we're looking at the different testing, and that's sensitivity versus specificity, which is a hard word to get over this time in the morning. But I see the percentages on the different testing kits. Can you shed some light on the actual meaning of those percentages for the audience today?
So these are really important numbers, and sensitivity is it's the higher percentage of a sensitivity for a test means that they're most accurate in detecting a true positive. So we want, when a test is being sold, when you're choosing a brand, the higher the sensitivity, the better, because then you'll know that it's truly capturing all your real positives. It's not missing them. Specificity, which I have trouble saying, the more specific the test, it's going to rule out all the true negatives. So if you've got a test that's got a really high specific percentage, that means that it's more often going to truly, if its test is negative, it's a true negative. And so it's really important to be sure that you're selecting tests that have a high percentage of both of these indicators.
Okay, that's very helpful, because obviously we see these different percentages. It's like, should I go for a higher one? Should I go for a lower one? Which is the best one? So what you're saying is, both of them need to be as high.
Important. When you get up into the 92 to 95, one's 95 and one's 92%. I mean, that's really not a significant difference, honestly.
Right.
It's relatively comparative.
Okay, and so I want to go back to something that you mentioned in one of your previous answers to the questions. Is now that vaccines are more readily available, do you think we'll continue to have an ongoing need for testing throughout the global maritime industry, not just on the cruise side of the house?
Absolutely. I don't think testing is going away anytime soon. It's here to stay for a long time, and the technology, every time I turn around, the technology gets better and better and better. And so it's hard to keep up with that evolving technology, which is great. Makes it difficult to make a decision when you want to make a purchase. But yes, testing is here to stay. It's a great tool to rule out disease. The key with COVID is here to stay. It's not going away anytime soon. COVID potentially can get on board vessels, regardless of how fabulous the procedures are to prevent it from coming on board. And the goal is to be able to identify COVID as quickly as possible on board a vessel, contain it, and reduce and limit secondary spread. So the testing and being able to diagnose is going to be critical for many years to come, I think.
Okay, no, it's a wise advice, because obviously we hear, vaccines are becoming more available. Certainly, crew are getting vaccinated these days.
Which is great.
Which is wonderful, and keep pursuing that for those of you joining us today. But testing is here to stay, as Holly said. So I want to move on to introduce my other colleague, who gets a bit more in depth in some of the different types of testing solutions that are more popular on the line. But before I do that, I just wanted to remind you that please feel free to utilize the chat function, ask any questions that you may have, and hopefully towards the end of this session, we'll have some time to be able to answer those. So welcome again, Tim. Appreciate you joining us today. I want to jump right into some of these questions. You know, Holly's given us a great overview of the differences between PCR and antigen, and as we're all learning, testing is here to stay, certainly for the foreseeable future. And so, you know, with yourselves, can you walk us through, first of all, some of the different PCR solutions that we're supporting many of our clients with?
Thank you, Russ. I will start off by saying I think we all are aware of the many different technologies that are out there for PCR testing for COVID. And the ones that we're going to just kind of run through today are the ones that we've seen as having the most interest, purchasing trends that we're seeing as far as our clients are concerned, and then that of the review of our medical operations team to just make sure that it's a appropriate type of technology for testing on board. So with that being said, we can start off with the Avid ID Now system. It has been around for a very long time. I did other testing prior to COVID. This test or this technology can be done via nasopharyngeal or oral pharyngeal. It only does one test at a time. It's approximately 5 minutes to a negative and approximately 15 minutes to a full positive. It is EUA certified as well as CE marked, CLIA waived, has a 94.7% sensitivity and a 98.6 sensitivity. Then the Cepheid Gene Expert Express system by Cepheid, and I want to make sure that I get all those words in there because the Gene Expert Express is the CLIA waived version. There's the Gene Expert that is not CLIA waived. So I want to make sure that people understand that difference. 30 to 45 minutes, depending for negative or positive. The nice thing about this technology is you can configure it to do multiple tests at a time so that your throughput is higher. It is EUA certified. It is also CE marked. And like I said, the Expert Express is the Expert Express is the one that is CLIA waived.
Okay.
We also now can go to the Coyote Bioscience. They have two machines out there on the market that are available, is the Flash 20 and the Mini Plus. This one can only be done via nasopharyngeal swab. It is one test at a time. Sample to results is approximately 30 minutes. It is EUA certified and CE marked with approximate 95% sensitivity and 99% specificity. The next one that we're looking at is the QIAstat by QIAGEN. That one, again, only done via nasopharyngeal sampling, one test at a time. You can add additional modules to that to increase your throughput. 67 minutes on average to results on this one. It is EUA certified, CE marked, CLIA waived, has 100% sensitivity and 93% specificity. And then the last one that we have seen purchased, inquired on with great frequency is the Randox by Bosch. It's the Vivalytic system by Randox. That can be done via nasopharyngeal or oral pharyngeal. They have various tests out there so that you can run multiple, look for flu, AB, RSV. Those tests, that combo test can take up to 2.5 hours for results. They do have a SARS only, COVID only, that takes approximately 39 minutes. It is not EUA certified, so obviously more popular with our European clients, and it has a 98% sensitivity and 100% specificity.
Okay, well, thank you ever so much, Tim, for the run through of the different solutions preferred by many of our clients. Obviously, I think the key takeaway from the PCR side of the house, both from yourself and from Holly, is what is the throughput of passengers? Because obviously some of these units take quite a while and you can only do one at a time, but some of them, by adding modules, you can do obviously multiple tests at a time. And so as we move on from the PCR testing, when we look at the antigen testing, as Holly mentioned, most of our clients are using a mix of these, whether they're in the cruise, commercial shipping, and other areas of the maritime industry. And so we know that antigen tests are becoming more popular, more widely used. The costs are reducing, which is great. But can you walk us through some of the various different solutions on the antigen testing side of the house?
Sure. To kick it off, we've seen the Veritor Plus. That's manufactured by Becton Dickinson. It's a small handheld device. It's approximately 15 minutes to result on this one. It is EUA certified. It is CE marked. It has an 84% sensitivity and 100% specificity. The PanBio is a product made by Abbott, is not approved here in the United States as of yet. It is CE marked, so widely popular with our clients over in Europe for antigen testing. That can be done via nasopharyngeal or anterior nasal, so at the very tip and edge of the nose there. There is no machine needed for this test. Again, 15 minutes to results, and 91.4 sensitivity and 99.8% specificity.
Okay.
Binax Now is available here in the United States and not in Europe. It is by Abbott. It is anterior nasal swab sample. Again, no machine necessary. 15 minutes to results. It is EUA certified, has a 97% sensitivity, 98.3% specificity on this one. The Quidel Diagnostic Sophia system by Quidel, that is a nasopharyngeal or nasal sample type device. It has a machine. It does have a machine that's necessary, and that machine can be used for other testing as well. So if that one was purchased, clients could use that for other testing other than just the antigen. 10 to 15 minute time to results. It is EUA certified, CE marked, CLIA waived with a 90% sensitivity and a 96.5% specificity. The CareStart product, widely popular here with our clients in the United States. That is made by Access Bio. It can be done via anterior or nasopharyngeal. There is no machine that's necessary for that test. It's a 10 to 15 minute time to results. It is EUA certified. It is CE marked. It has a 90% sensitivity and 100% specificity on that one. And then Lumira, the DX system by Lumira. That one is via anterior or nasopharyngeal. Machine is required on this one. So, and with that, it's approximately 12 minutes to results. It is EUA certified, CE marked, and has a 97.6% sensitivity with a 98.6 specificity. And then one product that I will mention here that's also on our little chart is there's a saliva test that is really building momentum here amongst our clients anyway. And we're working with a client, with a supply partner in the Scandinavian region. This is a saliva-based test. And so there's no swabbing. The sample is done just by spitting into a, into a little tube, and that tube connects with the solution. And you're in approximately 10 to 15 minutes, you have your results. There's no machine necessary for this either. Currently has a 90% sensitivity and a 99.9% specificity. It is not EUA certified at the moment. That is pending, but is CE marked And so from a guest experience, this could be a really nice product to add to, for our clients to have. So I just wanted to say real quick in wrapping up this part is that all of these technologies that I've talked about, unless you add components to them, they all relatively have a small footprint. The tests involved with these various technologies and manufacturers are all have the ability to be stored at room temperature. And then the manufacturers who have, where we have technology, a piece of machinery involved, those machines can be used for other testing, such as flu A/B, RSV, sexual health, depending on what technology you're looking at. So if you're not, if you're looking for a return on investment or wanting the ability to do other tests, there is that capability with the various technologies.
Well, thank you, Tim. That's a great overview. I just mentioned on the screen, you'll see three arrows pointing to three particular products on the screen there. Just want to point out that they're highlighted because they're the ones that are being preferred by many of our clients. When we share the array of the portfolio of potential solutions, but some of them are preferred for various different reasons based on the different size of their operations, whether it's a commercial ship, whether it's a guest carrying ship, be it ferry or cruise ship, etc. And so there are some, preferred different solutions. I want to go back to a point, Tim, that you actually made. Obviously, many of our clients deal with guests on board, whether that be the ferry industry, certainly private islands dealing with lots of guests, as well as the cruise ships. And obviously, it's all about guest experience. And so some of these can be quite invasive, and some of them least invasive. So in your your mind, and as you look through the different solutions here that we have, both for PCR and antigen testing, which ones would you say would be the kind of the least invasive, and would give guests kind of the least invasive option and best guest experience, I suppose?
From PCR, I would say the Abbott ID Now and the Cepheid. And then on the on the antigen side, I would say definitely the CareStart, the PanBio, and the VirusSpec, the saliva test, just because it's the non-invasiveness of these products, just really increases the guest experience.
Yep, yeah, that's a good point there. And so as we VIKAND obviously supplies solutions and medical services to each of the verticals within the maritime industry. So talk us through some of the preferred solutions by the verticals based on what we're hearing back from our customers and our clients, and which methods of testing, both antigen as well as PCR testing solutions that that they're finding in each of those verticals, if you won't mind.
I would concur with Holly and what she said earlier. We're really seeing a blend of products across the different verticals of our client base. So cruise, we're seeing antigen for screening, followed up with a PCR test on a positive. I will say in the yacht market, the most popular has been to just go with the Abbott ID Now, because it's easy to use with proper training. Taking the sample is not terribly, it's not difficult. And the results, it's just a really nice fit. It seems to be a very nice fit for the yacht market. And then on the commercial side, I would say, again, a blend of the antigen, and then probably most common would be the Abbott ID Now system, again, because of it's easy to use.
Yeah. Okay. I'd like to bring Holly back in to the discussion. Brief Q&A, we've got a few minutes left. I want to be sensitive towards people's time and appreciate you joining us today. Just want to remind you, feel free to use the chat function. And then any of the items that you've seen on the screen today that we've talked about, feel free to reach out to us as well. My contact information is on the bottom of your screen, or you can go to vikand.com and review any of the products that we're highlighting today in this virtual roundtable. VIKAND are here to support all of your needs to help you, restart. If you're in the cruise industry or if you're in other verticals of the maritime industry, support you and provide a safe and healthy environment on board. And we've got a question in from one of our commercial shipping partners. We operate container ships and bulk ships. What solutions would you recommend for testing our crew regularly when we don't have a medical practitioner on board? I'll throw that to either, Holly or Tim. Obviously, you both had conversations with clients, regarding this type of topic.
Yeah, either the PCR or antigen is fine. It's really about a couple factors that you want to weigh and how you want to approach this. The number of crew we're talking about. Are we talking 12 crew? Or are we talking 200 crew? Very different approach. Are you cost? How much do you want to invest in these two different options? Both are good. Both are easy to use, point of care. So really in terms of ease of use, they're both fairly similar. If you invest in one that's got a machine, you just, that I wouldn't recommend that for regular screening. Only the challenge with the screen is a machine is you've got to do the quality checks. Every time you move that machine, it's got to recalibrate, and you just have to keep that in mind that they're sensitive machines, and they get dropped, then that's a problem. Something happens to it. The cartridge approach, whether it's PCR or antigen, are both really good. Of course, PCR is the gold standard for more diagnostic, catching the disease earlier than later to reduce secondary spread. But antigen is an excellent option. So really, it's volume, cost, and what your preference is. Tim might have additional thoughts on that too. Sorry.
No, that's fine. I just to add to that, Holly, I think we're finding from some of our commercial partners that operate commercial vessels, they're using antigen tests on board, even though the crew are vaccinated. But then if they are finding a positive, they do have the capability more and more these days, in no matter which country they're docked in, is to go ashore for for a backup PCR test. So there is that option as well, not necessarily to carry PCR testing capabilities on board as well, which obviously.
Anytime someone has a questionable or positive antigen test on board and you don't have PCR capability, it is recommended to send them ashore or have someone come on board and do a PCR test to confirm indeed that it is a true positive.
Okay. Anything you want to add, Tim? You don't have to. Just wanted to open it up to you.
They covered it well.
And the question in from our yachting partners and clients from the yachting world, would you recommend we have testing available on board the yachts, even if there are just a few crew and guests on board? Obviously, yachts are a lot smaller than some of the larger vessels that we provide support to, but we also do support the global yachting industry as well. Just with a handful of people on board, are we recommending that we have, they have testing capabilities on board as well?
Yes, I strongly recommend it. It's becoming kind of a best practice or a standard. I think your customers would appreciate knowing that you have the ability to screen and test someone who might have symptoms. And the challenge with COVID is it's got an array of symptoms that are the same as a cold, and it just gives peace of mind that you can quickly screen and test someone there and assure them that you don't have COVID on board. So it's really important right now in this time, right at this stage, I would recommend.
Yep. I think just one final question that's just come in. All these devices were tested in a pre-variant kind of climate, and obviously we're hearing of different variants. So in relation to the different variants, are we gaining prevalence from these, like Delta Plus? Are the tests being modified in any way that you're aware of? You may not we may not be aware of those from the manufacturers, but are the units that we've looked at today in the different testing solutions, do you know if they are able to capture some of these variants that we're seeing in the world? Not sure if either one.
I will just say I have spoken with Abbott and Cepheid at length, and they are continually testing to make sure that their technology and the tests that they are using for COVID are keeping up as best as possible for the various variants that are coming out there. Those two I can say yes. I can't be 100% certain on the others.
Yep. Okay. So. Well, thank you ever so much to both of you. Thank you for joining our virtual roundtable today. We hope that was helpful to give you an overview on the PCR testing solutions that are being used in the global maritime industry, as well as the antigen testing, the differences between some of those. I appreciate the input both from yourself, Tim, and from Holly. If we weren't able to get to your questions today, we will certainly follow up with you after this session. But if you need any more information on any of the solutions that we've discussed today, or any of the other solutions or services that VIKAND can provide to your operations to support them, certainly from the cruise side as you plan your restarts, to the rest of the maritime industry as you continue to go about business, VIKAND are here to support you. If you want any more information at all, please go to vikand.com or contact me at the contact information you see on the bottom of your screen. Thank you ever so much. Enjoy the rest of the day, no matter where in the world you join us from, and stay healthy and stay safe. Thank you.
Bye.